Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Annasodas Vyadhi and we have discussed Chardi and Atisar. Atisar, one lecture. And I have tried to explain you that how different principles of Chikitsa can be applied in the same Vyadhi according to Rugnabala, Vyadhibala, Rugnavaya, Samavastha, Niramavastha, etc. In last lecture, we have discussed Atisar as in general, Sarpatya Atisar, Sam Niram Avastha, and Grahi and Stamban principles of the Chikitsa. Today, I am going to explain you the shades of Samprati which are very important to understand in any disease which is not explained in the text. It will be might try to explain that the some minute shades of the Samprati which really get ignored. Let us start with that. In Samprati, what we have seen that Vata Prakop and Dushit Jala comes in the Koshtha because of this Prakopit Vata dosh, and the further Samprati happens. I have it explained in details. So, in the treatment, also we have seen two parts. One is Grahi and other is Stamban, depending on Samavastha and Niramavastha respectively. Definition of Grahi, we have seen Dipanam Pachanam Yasyat Ushnatvat Dravashoshakam. So these dravya are of Ushnavirya and they are Dipan Pachan, and because of Ushnavirya Dravashoshanam. Now these Grahi dravya by their properties will neutralize Vata dosh as well as Dushit Jala because Ushnavirya will act on both these basic factors of the Samprapti. So it is logically very understandable. My question is, when we are dealing with the Stamban Karma, the definition of Stamban is the Stamban Dravya are Kashaya, Ruksha, Laghu. Okay. So these three factors, okay, we can understand that they are against Jala and they will absorb this Dushit Jala and Atisar will be stopped. But next step is very important. They have mentioned specifically Vatakru Stambanam. That because of this Kashaya Ruksha Laghu properties, Stamban Dravya are obviously Vatakrut. Now, Jala and Vata dosh are the basic factors of the Samprapti. Okay? Kashaya Ruksha Laghu will take care of Dushit Jala Dhatu. One factor is neutralized. But they are increasing Vata dosh which is already Prakopit, and it is also a major factor of the Samprapti. So in the definition of Stamban, they have clearly mentioned it is Vatakrut. Vata dosh is a major factor, one of the factor in the Samprapti according with Jala. Still we use Stamban without any doubt in the mind that it will increase Vata dosh and Samprapti will be increased. We never think of this thing that this Sambandh Dravya will be create some problem. On the contrary, patient says that I have to go to the work, please stop the Atisar as early as possible. In that case, many times, not a rule, many times we have to deal with the Stamban Dravya only, irrespective of Grahi Dravya, because of the circumstances of the patient. So by any way we use Stamban, we never think of the Vata Prakop, and my question is why? First thing. Secondly, in spite of using Stamban Dravya, you will find a Samprapti Bhanga is done and Atisar is stopped. So what happens to that Vata dosh which is Prakopit in the basic of the Samprapti of the Atisar? Why I am putting this question in front of you? Because Prakopit Vata dosh and Jala dosh is the generalized statement. In every Samprapti, you should go further in detail of the Samprapti or Vyadhi Ghatak and you should know their intensity or their exact role in the treatment, or their what you can say major contribution in the samprapti, because depending on that factor you have to choose to which factor is most prominent or dominant in the samprapti, and it should be taken care of as early as possible. In Atisar, yes, Vata is there, but dominant factor is Dushit Jala Dhatu. And what Jala Dhatu's nature is, because of Dharva Guna, it comes to Koshta. I will explain this phenomenon in when we will see other in details. At present, just keep in mind that Jala Dhatu comes in the Koshta. Prakupit Vat, here it means it just pushes that Jala. The guna of Vayu is one of the basic major significant property of Vayu is Chala guna. And what is that Chala guna means? A definition, Prerane Chala. It's a very excellent word which I really like. Prerane means it just stimulates. It just gives a push. So when we say Prakupit Vata Dosh, its role in the Samprapti of Dushit Jala, which is already occupied in the coaster, it just give a trigger. I will explain you in another example. There is a hill, and on the edge of the hill there is a stone. At present, it is really at the edge of the stone, at edge of the hill. It has stable there, but it is in a position that it can go downward anytime. But when it will go downwards, when it will get some push by a human, by air, by wind, anyway, that little push is also sufficient to further happening in the further process, that stone, the little push will give that trigger to the stone, and it will go to the from upwards to the downwards of the hill, top to bottom of the hill. Same thing happens in Atisar. Jala is already, it is so dushita, or it is so prakupit Jala Dhatu, it requires just a small push that it starts flowing from the Amashay, Grahani, Pakvashay, and gets expelled out of the body in the liquid form. Hence, though there is presence of Vata dosh, we use Sambandh Dravya because the role of Vata dosh in the Sampratya Atisar is not so dominant as compared to Jala Dhatu. It has the action of just giving trigger or just giving stimulus, just give a push to that Jala Dhatu, and Jala flows. As nature of Jala is Drava Guna, and Drava, definition of Drava is which flows from upside to downside, upwards to downwards. So this is the shade of the Samprati which I am trying to explain you, that when we read Samprati of any disease, just these three factors are in the Samprati is not enough at all. You have to think which is the dominant factor of the factors which are in the Samprati of that particular Vyadhi. Each role of each factor and its intensity, and then you have to choose which factor to be neutralized or to make normal as a dominant factor. So this is the shades of the Samprati which I wanted to explain you on the background of the Atisar. Another question for you as a homework: Atisar liquid is expelled through the rectum, and in the Chardi it is expelled through the mouth. So more of the time there is loss of Abdhatu. But if you compare two patients, one of Chardi and of Atisar, you will find the patient with Chardi will tell you, just I have one vomiting and was exhausted. It is common experience. And in Atisar, he will tell, no, I have to go 4 or 5 times and then I started little bit of weakness. Now, why this thing happen in the body, we will discuss in in some time in the future. Thank you very much.